Hi, I'm Dr. Bill Lyle, and I practice obstetrics and gynecology. I'm board certified in obstetrics and gynecology. I'm licensed to practice medicine in Florida and Alabama, and I love what I do. Today's topic is informed consent. Before anybody has a surgical procedure, they undergo informed consent, which is not just a form, it is a process where the risks, benefits, indications, and alternatives of a procedure are discussed in detail with the patient. I'm going to read to you from ACOG's committee opinion number 439. I want to know what ACOG, the American College of Obstetricians and Gynecologists, says about informed consent and patients. ACOG is not pro-life. ACOG is very much pro-abortion. But I want you to listen to some of the terminology. First, seeking informed consent expresses respect for the patient as a person. It particularly respects a patient's moral right to bodily integrity. So the key word is patient. What is a patient and how is a patient defined? We are doing invasive surgeries on babies while they are inside the womb. At our hospital, we can do blood transfusions directly to the baby on the inside of the womb as early as 19 weeks gestation. Sometimes that has to be done every 3 or 4 weeks throughout the pregnancy because the mother has antibodies which are attacking the baby's blood. The mother sees the baby as a totally different person and is trying to reject it. So we're giving blood transfusions to the babies. Centers around the country are now doing heart surgery, valvuloplasty, septoplasty as early as 22 weeks while the baby is still in the womb. The heart is only the size of a grape and they're doing these surgeries. They're also doing spina bifida surgery, repairing baby spines before these babies could even survive on the outside. It sounds like if they're having heart surgery and spine surgery and getting blood transfusions, that they are patients. We can actually do genetic testing and determine if it is a male or a female as early as 7 weeks after conception, 9 weeks after the first day of the last menstrual period through a technique called cell-free DNA. So if we're doing all these procedures on the babies on the inside who are genetically totally different from the mom, it is a different person, it is a different patient. Well, how should we treat patients? Well, when it comes to treating patients, to provide medical benefit to patients and thus to respect them as whole and embodied persons. So that's according to ACOG. So if they are a patient, then they are persons, and if they are persons, then they're entitled to all the rights under the 14th Amendment. Nor shall any state deny any patient of life, liberty, or property without due process. So that's the real key. If they are patients, they are persons, and if they are persons, they deserve to be protected. Well, what if the baby can't communicate with you? I mean, even babies on the outside of the womb can't communicate, so how do we get informed consent on what to do for them? Well, we have to go back to ethics, and we have to think about a few things. Number one, we have to think about respect for the person, but ACOG also says that these decisions require that the patient be protected. So if it's a patient, it's a person, and if it's a person, it needs to be protected. But then when the baby can't make its own decisions, then a surrogate decision maker would be employed. And the process of what does the surrogate decision maker make? Well, they think about what would the patient say. Well, a decision based on what the patient would have wanted. I guarantee you, if you could ask the baby on the inside of the womb, a baby that we're treating as a patient, what they would have wanted, they would want to live. There's no doubt about that. So when you put yourself in the mind of the patient on the inside, what would the baby want? If the baby were given the decision, would you rather live or would you rather die? Of course, when you put yourself in the baby's mind, the baby would prefer to live. And the third thing is that this surrogate makes a decision according to the best interest of the patient. So the patient is the baby on the inside. Again, we're doing blood transfusions, heart surgeries, spine surgeries on the baby on the inside. So it's clearly our patient if we're doing these types of procedures. So what's in the best interest of the patient? These are the ethical rules and the ethical standards that we're trying to work our way through. But clearly, if this is a patient on the inside, it is a person. And if it is a person, it deserves our protection, our respect, and we have to put ourselves in the mind of the baby and say, what would the baby want? And I guarantee you, if we could put ourselves in the mind of the baby would say, I want to live. I love treating the preborn. We treat them as patients at our institution. We are advancing in the way we treat the patients as persons. God bless y'all. If y'all have any questions, you can contact me through my website, prolifedoc.org. And if there's anything I can do for you, just let me know.